السلام عليكم ورحمة الله تعالى وبركاته. We will talk about axilla. What is the axilla? Axilla or armpit. It located between the upper chest and upper arm. Which structure located here? It contains the branches of the brachial plexus, axillary artery, axillary vein, axillary lymph node, and all the structure embedded in the axillary fat. The axilla is a pyramidal space. It has apex, base, medial wall, lateral wall, anterior wall, and posterior wall. Let us start by details one by one the boundaries of the brachial plexus. The apex located here. So the apex connect the neck with the upper limb. This apex form is triangular in shape and known as cervico-axillary canal. Cervico-axillary canal because it connects the neck with axilla or upper limb. The cervico-axillary canal is triangular in shape and is formed anteriorly by clavicle, posteriorly by upper border of the clavicle, medially by first rib. The base of the axilla. The base of the axilla is formed by the skin, which extends from the arm to the thoracic wall. The anterior wall. The anterior wall of the axilla is formed by pectoralis major muscle, pectoralis minor muscle, and we have anterior axillary fold. This one. This one known as anterior axillary fold. When you abduct your upper limb, you can see that you can palpate the anterior axillary fold and posterior axillary fold. The anterior axillary fold is higher than the posterior axillary fold. So the anterior axillary fold formed by pectoralis lower border of the pectoralis major muscle. The posterior wall. The posterior wall formed by subscapularis muscle, teres major muscle, and latissimus dorsi, and more posteriorly by scapula. The posterior axillary fold formed by the lower border of latissimus dorsi. The medial wall of the axilla is formed by the upper rib and intercostal muscles and serratus anterior muscle. The lateral wall is formed by humerus here, which part of the humerus is bicipital groove. Okay, again, the axilla or armpit has the apex, base, medial wall, lateral wall, anterior wall, and posterior wall. The apex here is formed by cervico-axillary canal. The anterior wall formed by pectoralis major, pectoralis minor. The posterior wall formed by subscapularis, teres major, latissimus dorsi, and scapula. The medial wall formed by the upper four ribs intercostal muscle and serratus anterior. The lateral wall formed by bicipital groove. Content of the axilla: axillary artery and its branch, axillary vein and its tributaries, brachial plexus, the cord and the branches of the brachial plexus, lymph node and lymph vessels, fat and areolar tissue. Okay, this structure located in the axilla, axillary artery, the cord and the branches of the brachial artery, brachial plexus, axillary vein, axillary lymph node, and other. Axillary artery. What is axillary artery? Axillary artery is a continuation of subclavian artery at the lower border, at the lateral border of the varus rib. So this is a subclavian artery. Subclavian artery here at the outer border of the varus rib changed its name from subclavian artery to the axillary artery, and at the lower border of teres major changed its name to the brachial artery. So here is axillary artery. Beginning of the axillary artery from the outer border of the varus rib as a continuation of subclavian artery, and terminate at the lower border of teres major and become brachial artery. Okay, the branches. Before the branches, this axillary artery divided into three parts by pectoralis minor muscle. First part, second part, and third part. The first part located medial to pectoralis minor. The second part located behind the pectoralis minor. The third part located distal to pectoralis minor muscle. The branches of the axillary artery: from the first part originate one branch, from the second part originate two branches, from the third part originate three branches. From the first part give rise to the superior or highest intercostal artery, which supplies the thoracic wall. From the second part give two branches, which are lateral thoracic artery to supply the thoracic wall, and thoracoacromial artery, which supplies the area of the shoulder joint. From the third part give three branches, which are anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. Okay, this is a branch. From the first part, highest or superior thoracic artery. From the second part, lateral thoracic artery and thoracoacromial artery. From the third part, anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. Okay, again the branches here: superior or highest intercostal artery, lateral thoracic artery, thoracoacromial artery. From the third part, anterior circumflex and posterior circumflex, and dorsal scapular artery. Okay, axillary vein. The axillary vein نحن بنقول الارتري from the heart to the upper limb. Axillary vein opposite from upper limb towards the heart. So it is formed by the brachial veins that join the basal vein to form the axillary vein. The brachial veins, or the vena comitan of the brachial artery, joins the axillary vein at the lower border of teres major to form the axillary vein. And the axillary vein terminates at the outer border of the varus rib to form the subclavian artery. Okay? Axillary lymph node. The axillary lymph node divided into groups. Axillary lymph node divided into groups, which are anterior group, posterior group, central group, apical group, and lateral group. Anterior group, posterior group, this is the central group, this is the apical group. Okay, here is the anterior group, here inferiorly, sorry, this is the lateral group or humeral group, this is the posterior group, here is the anterior group, here is the central, and here is the apical. Okay, the anterior group located on the lower border of the pectoralis minor muscle. It receives the lymph from the thoracic and mainly from the breast, and sends the information to the central group, or sends the lymph to the central group. The subscapular group or posterior group receives the lymph from the back and the scapular region and sends the lymph to the central group. Okay, the lateral group receives the lymph from the upper limb and sends the lymph to the central group. So the central node or central group receives the lymph from the anterior, posterior, and lateral group and sends the lymph to the apical group. This apical group or apical nodes located at the apex of the axilla near to the first rib and sends the lymph to the subclavian lymph trunk. This subclavian lymph trunk sends the lymph in the right side to the lymph trunk and to the left side into the thoracic duct. Thank you very much.